October is Breast Cancer Awareness Month, but there are some dietary changes you can make year-round to lower your risk. Joining us with more is Mark Mincolla, Ph.D. and natural health care practitioner from Cohasset, Massachusetts. Hey, Mark.
Good morning.
Good to have you here.
Good to be here.
So there are things you can eat that make a difference. You're always telling us this. Where do we start in terms of breast cancer prevention?
Well, among the most important things, we need to realize that there are things like indoles that are actually kind of natural estrogens that antagonize and drop down those levels of dangerous estrogens. Very important.
All right. So what do we eat?
Well, we're talking about things like cabbage and broccoli, which are loaded with indoles, and these indoles are actually the very thing we just talked about. They will lower those dangerous estrogens. Also, beans are very high in protease inhibitors. A number of epidemiological studies that indicate that those women who do eat higher levels of beans in the diet have significantly lower risk factors.
Any kind of beans?
Well, yes, any legumes, any beans, black beans, kidney beans, pinto beans, etc. Also, a number of studies that the Canadians have done regarding fatty fish. Now, fish has the omega-3s, and those are anti-inflammatories. Breast cancer is an inflammatory disease, so a great way to counteract those.
You take a fish oil tablet instead?
1,000 milligrams per capsule, absolutely one a day. Oat bran, also fiber. We're talking about studies that have indicated a dramatic risk, 17%, by simply increasing your fiber up to 30 grams a day for 2 months. 17% reduction in these dangerous estrogens. Vitamin D, of course, a study recently said 4,000 units can cut the risk by 50%. So remarkable stuff.
And when you talk about fiber, can you do a fiber drink at night? Does that help too?
Sure. What we're talking about here is we're talking about the kind of fibers that come from your fruits and vegetables. Those soluble and insoluble fibers both together from your grains and from your fruits and vegetables really make a big difference. 30 grams a day, the average person is only getting about 15, so fiber is really important.
All right, and vitamin D, huh?
Vitamin D, there's more studies that continue to come out over and over regarding the importance of cancer and heart disease prevention, cold and flu prevention. Vitamin D is really important.
Okay, and you have a book you want to recommend for people?
Yeah, the Breast Cancer Prevention and Recovery book by Susanna Olivier is a very, very good book. I think a lot of folks will enjoy that book.
All righty, Mark Mincolla, thanks so much for joining us
Great
this
to be
morning.
here. Thank you.
And during this breast cancer